Hemodialysis is actually, when we talk about hemo means blood in Latin. So hemodialysis is the dialysis of the blood, and it requires an access to your blood circulation. Usually we encourage you to prepare for an access through what we call a fistula, which is a connection between your artery and a vein. Sometimes it's native, and that is the most preferable form of access. Or it could be a plastic tube in certain circumstances where your veins are hard to connect. And in cases of emergency, we use a plastic catheter we place over the collarbone into the jugular vein. Now, these are the modalities where we have access to your blood, and then we take your blood into a dialysis machine and circulate it and cleanse it. And that's exactly what hemodialysis is. The advantages of hemodialysis are few. Where you come 3 times a week, you don't have to do a lot of work. A technician and a nurse are trained to do your dialysis. And you do that, but the disadvantages are many. Your diet is very restricted. You are tied to the dialysis machine and dialysis center 3 times a week. Sometimes you can do it at home. And you have these, what we call hemodynamic, means the blood vessels and the heart go through the ups and downs. On the days you don't dialyze, then the days you dialyze, we relieve the fluid retention, and then we bring you back the following day, and you have more fluid retention and so forth. So you will have ups and downs. You will have difficult blood pressure to control sometimes. Your diet is very restricted. You will hear the term potassium, phosphorus, take your binders, watch your potassium. And that is hemodialysis, where we access your blood. Now, based on your circumstances, you may also choose to do it at home, which is the best modality that you can do. It's the same thing, but you do it in your own home and your own convenience. Don't deny that you have progressed to advanced stages of kidney disease, because if you place an access in your arm for hemodialysis, you have a chance to reduce the risk of progression for a reason we don't know why, but studies have shown that you place access early, you can reduce the risk of progression to end-stage kidney disease. So you will do well and you will stay off dialysis for a longer period of time with only placing an access in your arm. And you can visit our website to the page of choices, and the link is down below. Stay healthy and stay safe. I'm Dr. 𝗓𝗨, the virtual nephrologist.